Diagnosis of ear infections. Doctors diagnose ear infections by examining the ear using an otoscope. This allows them to check for redness, swelling, fluid, or a bulging eardrum. In some cases, hearing tests may be done to check hearing loss. Repeated infections may require further tests to find the underlying cause. Treatment options. Treatment depends on the type and severity of the infection. For mild infections, doctors may suggest observation, rest, and pain relief medicines. Antibiotics are prescribed if the infection is bacterial. It is very important to take the full course even if symptoms improve early. Ear drops are commonly used for outer ear infections to reduce inflammation and kill bacteria. For viral infections, antibiotics are not effective and recovery usually happens naturally. In cases of repeated or severe infections, doctors may recommend a minor surgical procedure to insert ear tubes and drain excess fluid. Home care and relief methods. Home care can help reduce pain and speed recovery. Using a warm compress on the ear can relieve pain. Staying hydrated helps thin mucus and improve drainage. Avoid getting water inside infected ears. Never insert objects into the ear canal. Prevention of ear infections. Preventing ear infections is possible with simple habits. Wash hands regularly to avoid infections. Avoid smoking and exposure to smoke. Keep ears dry after swimming or bathing. Treat colds and allergies early. Keep vaccinations up to date, especially for children. Possible complications. If untreated, ear infections may cause permanent hearing loss, eardrum rupture, or spread of infection to nearby tissues. Recurrent infections in children may affect speech and learning development. Conclusion: ear infections are common but manageable with early care and proper treatment. Recognizing symptoms early and seeking medical advice can prevent serious complications. Maintaining good hygiene and healthy habits can greatly reduce the risk of ear infections. Ear infections are one of the most common health problems seen in both children and adults. They can cause pain, discomfort, and hearing difficulties. In many cases, ear infections start suddenly and may become severe if ignored. Children are more prone to ear infections because their immune systems are still developing. In this video, we will explain ear infections in detail, including their causes, symptoms, diagnosis, treatment, and prevention methods. Understanding the ear structure. The human ear has three main parts: the outer ear, the middle ear, and the inner ear. The outer ear collects sound waves. The middle ear contains small bones that transmit sound. The inner ear controls hearing and balance. Ear infections usually develop when germs enter any of these parts, most commonly the middle ear. When fluid builds up behind the eardrum, it creates pressure and pain. Types of ear infections. There are three main types of ear infections. Outer ear infection, also known as swimmer's ear, affects the ear canal. It is often caused by water trapped in the ear, allowing bacteria to grow. Middle ear infection is the most common type. It usually happens after a cold or throat infection and causes fluid buildup behind the eardrum. Inner ear infection is less common but more serious. It affects balance and hearing and may cause dizziness or nausea. Causes of ear infections. Ear infections are mainly caused by bacteria or viruses. These germs often come from respiratory infections like colds, flu, or sinus infections. Another major cause is blocked eustachian tubes, which normally drain fluid from the ear. When these tubes become swollen due to infection or allergies, fluid stays trapped. Allergies increase mucus production and block air passages. Secondhand smoke irritates the ear and increases infection risk. Poor hygiene, such as using dirty earbuds, can introduce bacteria. Swimming in dirty water can cause outer ear infections. Weakened immunity makes it harder for the body to fight infections. Common symptoms of ear infections. Symptoms vary based on age and severity. The most noticeable symptom is ear pain, which may be sharp or throbbing. People may feel pressure or fullness in the ear. Temporary hearing loss or muffled hearing is common. Fluid drainage, sometimes yellow or white, may come from the ear. Fever often occurs, especially in children. In children, additional symptoms include crying, restlessness, ear pulling, difficulty sleeping, and loss of appetite. Inner ear infections may cause dizziness, balance problems, nausea, and vomiting.